there's a really exciting area, well, certainly exciting within my practice, which is neuromodulation in spinal conditions. And specifically, I use neuromodulation in the context of trials to try and restore aspects of function following spinal cord injury. Possibly less relevant, but maybe interesting to your audience. People with spinal cord injuries, we always tend to think of them as wanting to restore volitional movement. That's what we would assume. But actually, the main things that they want to recover are bladder, bowel, and sexual function. There's some exciting work going on around the world. Gregoire Courtine in Switzerland, a part of the Onward company, but at EPFL. Susie Harkamer in Louisville in Texas, and David Darrow, not Louisville in Texas, in Louisville. David Darrow in Minnesota, Max Boacci in Louisville as well. I'm sort of privileged to be able to work with the team at the London Spinal Cord Injury Centre, so that's at the Royal National Orthopaedic Hospital. And we're trying to use electrical signals to restore aspects of bladder and bowel function, and we've done it in a few in a few people. It can work. We don't know the best ways to make it work yet, and so we have received funding for a trial called the Impress trial towards the end of last year, and we're hoping to start recruiting this summer. And what we'll do is we'll use implantable pulse generators. So these are devices traditionally used in pain procedures to stimulate parts of the lumbosacral nerve roots and also the conus of the spinal cord to try to improve bladder and bowel function. So it's a really exciting area.
Yeah,
we're seeing neuromodulation come in the whole of spinal health. The example that you gave with the foot drop device is one of them, but there are also peripheral nerve stimulators, vagal nerve stimulators, and the spinal cord stimulators. So it's a really exciting area.